purpose, but standing up for the core principle that in America, everyone deserves access to quality, affordable health care, I think is a value that we share as Americans. And as someone who sat on the Senate Finance Committee when we were making the Affordable Care Act become a reality, we knew that it wasn't a perfect bill. We know that there are things that we can do to improve it. But every time we have tried to improve it, open up the patient to heal it, our colleagues have sought to slay it. And that's the fundamental problem that we have here, that we cannot get Republicans to join us in an effort to improve health care, but not to slay the very essence of what means so significant coverage to so many people. It's no exaggeration, therefore, to say that Republicans have put this country on a crash course that will endanger American lives and will threaten the financial security of millions upon millions of families. If President Trump thought the House bill was mean, well, this Senate bill is downright nasty. Page by page, their plan asks Americans to pay more for less. It kicks $22 million off of health care insurance. It ends the Medicaid expansion that extended coverage to over 500,000 New Jerseyans alone. And it is especially cruel to the millions of families across America struggling with the scourge of addiction. According to the CDC, over 1,454 New Jerseyans died of opioid overdoses in 2015, the most recent data we have. I know that number is even greater because I've heard from these families as I have traveled across the state. Nationwide, nearly 2 million people remain addicted to prescription opioids, and another 591,000 addicted to heroin. And I cannot for the life of me understand how Republican colleagues can reconcile. I listened to them on the Senate floor, and I was applauding them, passionately talking about the scourge of opioid addiction in our country. But you can't speak with passion and sometimes with tears about that and then vote for this. You can't do that. It rings really hollow. And so ending Medicaid expansion and Medicaid as we know it, beyond Medicaid expansion that is saving so many lives, is just really, for many people, going to be a death sentence. Every day I hear from New Jerseyans who credit Medicaid expansion with turning their lives around. Just this past Friday, I met with a constituent named Alton Robinson from Rockaway in Morris County, New Jersey. He told me that after nearly 2 decades of struggling with addiction, it was Medicaid expansion that saved his life. It allowed him to get the substance abuse treatment and the physical and mental health care he needed to beat his addiction. Today, Alton is clean. His life is on track. And an incredible part of that is that he is spending his working days helping other New Jerseyans get on the path to recovery. Since last August alone, he's helped 264 people help to beat their addiction, the vast majority of them relying on Medicaid for paying for their care. But under the Republican health plan, New Jersey will lose at least $30 billion in Medicaid funding over the next decade. And the $2 billion they set aside, as Senator Markey said, to fight the national opioid crisis next year is an insult to every community battling this epidemic. Not only the amount, but that's a one-time, one-year amount. The opioid crisis is unfortunately going to be with us far beyond 1 year. And what would my Republican colleagues say to the parents who reached out to me in recent weeks, fearing for their children's lives? What would they say to Irene, the mother in Oakhurst, New Jersey, who wrote me last week to say, quote, "My daughter is a recovering drug addict on the Medicaid program which pays for mental health care and services. She's part of the opioid epidemic that has taken the lives of so many young people like her. She's been drug-free for almost a year. Taking money from this program would be disastrous not only for her, but for so many people who cannot afford any other health care." Now, apparently the Republican answer to recovering addicts like Alton and to caring parents like Irene is, you're on your own. President Trump said he wanted a health care bill with heart, but this Senate Republican effort and the hope to try to pass this bill has no heart. It's about as heartless as you can get. They sold out our health care system to a bunch of millionaires and health insurance executives, and all of us will pay the price. We'll see that price in our communities. We'll see that price in torn families. We'll see that price in the growing movement towards heroin, cheaper than the opioid prescription drugs, and the consequences just in that one dimension is more than we should allow to happen under any set of circumstances. Should Republicans pass this bill, millions of Americans will be denied access to life-saving treatment. In other words, more people will die. And as far as we're concerned, not on our watch. With that, let me introduce the senior senator from Minnesota, Amy Klobuchar.
Thank you, Bob. So Minnesota lost a favorite son to opioid addiction. That's Prince. But what's under that story are all of the many people whose lives were lost that weren't famous. The mom in Duluth, the star swimmer from the farmlands. In America today, 50 people die every day from opioid overdoses. 50 people, that's 2 classrooms of people every single day.